Now, I'm just going to check your blood pressure again, Mrs. Slotnick, and your pulse. And then we're just about ready to let you get off to sleep. And while I'm doing this, I want you to do some of that nice deep breathing that you were doing before. Yes.
Helen Slotnick is a mother of 3. She's 50 years old and lives in Randolph, Massachusetts. She's about to have her gallbladder removed. She's healthy, and the chances of surviving the operation are extremely high.
That's great. And you're going to find that you're going to gradually get a little bit more sleepy because I've given you some tranquilizer in your intravenous. And when I give you the Pantol, I'll let you know. I'm giving her a bit of Demerol now, which is a narcotic, and that's going to be part of our anesthetic management. That's it. And now, I'm about to give you Pantol, and I'm going to put
Helen Slotnick's life depends on the success of this operation. This, in turn, will depend on the skill of the surgeon. But the surgeon would be unable to cut her open were it not for anesthesia, and were it not for the fact that she can be made unconscious. For without anesthetics, without her being unconscious, the pain of the operation would kill her.
That's the way. All right. Now, just take some nice, easy breaths.
During an operation, we tend to think that it's the surgeon who takes the patient's life in his hands. But the surgeon is responsible only for that part of the patient's body that's diseased. It is the anesthesiologist, here Dr. Susan Larmont, who's responsible literally for keeping the patient alive.
Nice big breath. Oh, that's the way. You're doing just fine. When you wake up, you'll be in the recovery room. There's going to be a plastic oxygen mask on your face. And you're going to take some of these same big breaths that you're taking now. Everything's going to turn out all right.
Dr. Larmont is giving Helen Slotnick drugs that will prevent any pain from reaching her consciousness. In addition, she's giving her muscle-relaxing drugs. In the operation, she'll be unable to move a single muscle. Once she's asleep, the anesthesiologist has to breathe for her, and so will become her link between life and death.
She's asleep now.
Every year, within the walls of a modern hospital like the Massachusetts General, thousands of patients are anesthetized. It's an achievement of science we take for granted. But only 130 years ago, there was no anesthesia. How then has it come about? Who discovered the strange sleep of anesthesia? The purpose of this film is to answer these questions. But first, let's go back to the original wing of the Massachusetts General, to the days before anesthesia. The year is 1840. The patient is Patrick Flint, recently arrived in Boston from Ireland. His leg has been crushed between a ballast barge and a lock in the Merrimack Canal. This happened 2 weeks ago. Now gangrene has set in. The surgeon is John Collins Warren.
Good morning.
Good morning, sir.
Warren is one of a famous line of Boston doctors. Indeed, he's one of the few doctors in Boston who have any real knowledge of human anatomy and physiology. For the hospital is new, and medicine still on the boundary between scientific knowledge and quackery. But without anesthesia, a surgeon's role is limited. Surgery has to be done at incredible speed. What Warren can teach his students, then, is as much a matter of moral strength as technique.
You understand our purpose? Mr. Flint, will you have your leg off, or will you not have your leg off?
Yes.
Laudanum, please.
Laudanum is a mixture of opium and wine.
Good.
It may make the patient drowsy, but it will do little to remove the pain.
Make fast. Apply the tourniquet. Good. Knife, please. Time me, please. Suture, please. Saw, please.
In reaction to the pain, the blood that normally serves the brain rushes to Flint's leg, and he becomes unconscious. This is known as shock. If shock continues and the operation is not completed soon, the patient's brain will not have enough blood, and his heart will stop pumping.
Time.
1 minute, 50 seconds.
Time is of the essence. Would for Mr. Flint that it could have been done more quickly.
The great surgeons are those that can operate the fastest, for speed is the only way of preventing a patient from dying of shock. Yet this means that the arteries may be so badly damaged that the patient may bleed to death. But at least an amputation can be done. For many patients visiting the hospital, the picture is even bleaker.
Doctor, could you please take a look at my husband? I don't know what's wrong with him. He's been awful sick for the last few days.
Has he vomited? Does he have a rupture?
I don't know, Doctor. Do you think you could take just a look at him and see what's the matter with him?
Certainly.
Mike, the doctor's going to look at you.
Would you mind standing up for us?
I'll try.
Now just take... There we are. Now, where does it take you?
Over here, sir.
This man has all the symptoms of an inflamed gallbladder. Yet there's nothing that Warren can do for him. Unlike the man with the injured leg, there's no way of opening up an abdomen quickly. And so without anesthetics, there's no question of an operation.
Sit you down.
Doctor, we don't have any money. We just take...
All that Warren can do is send the man away with sympathy and enough morphine to make the pain less unbearable. In a short time, the gallbladder will rupture, cause peritonitis, and kill him. But in the 1840s, it is not only surgeons and their patients who have to face the problem of pain.
You took the roots out separately.
These are two Boston dentists, Morton and Wells.
Very well. I'm wondering...
Their desire to do better dentistry is directly hampered by a lack of something with which to kill pain.
Come in.
Hello.
Mr. Will?
I'm Mr. Morton.
Oh, I'm Mary Comstock.
Mary Comstock comes from a family of rich Boston opium merchants.
I've got a problem I've been having with some of my
Her teeth are rotting,
Well,
and now she's worried about how she appears.
I've been to a number of dentists.
At this time, most dentists are unwilling to extract teeth. They merely place false ones on top of the old rotting stumps.
I mean, there must be something else.
But Mary Comstock has heard that Morton and Wells have a reputation for making natural-looking false teeth.
It depends on the situation.
Perhaps if you sat down, we could examine you. Then I think we'd be able to tell you a little bit better exactly what we have
I don't want
to offer.
anything done today. I've just
That's
come for some
perfectly right.
advice.
Why don't you sit down? Let us take a look, okay?
I don't want anything done. I just came to see if there wasn't something
What Morton and Wells are trying to sell, essentially, is a procedure that's less disfiguring, but much more painful.
This one's rotten almost down to the gum over here. Once again, please open wide. Over here, things are about as bad. Well, my opinion is that with the teeth in that condition, you would be much better off to have the majority of them out, in fact. If we leave those roots in place, then your lips are going to be held out so much that it will really ruin the appearance of your face, and I think that would be a
Mary
terrible
Comstock's
disturbance.
choice is not easy. Either she faces the extremely painful prospect of having her teeth pulled out,
Miss Comstock,
or she goes to a dentist who will give her false teeth that may make her a laughingstock.
After that, the results are so much better that I'm sure that
Is there
you'd be...
something you can do besides?
operating besides cutting? I mean, how do you go about doing that? It must be very painful.
Well, we do have several ways, in fact, of making the pain much more bearable. We have, for instance, over here some brandy. And
I'm sorry, I don't drink.
This would be for medicinal purposes, though.
Well, brandy doesn't really...
Why don't you show us once again?
No, I'm
Maybe
sorry.
we can...
I really didn't come to have anything done today. I just came to ask your gentleman's advice. Thank you very much.
Morton and Will's success would be assured with something to control pain. There are many drugs on the market, and Morton and Wills continually hear rumors that a new drug has been found or a new method of applying an old one. But there are few medical journals to communicate new discoveries, and only rudimentary methods of classifying drugs.
Good day, sir.
Good day.
May I help you?
So the dentists have little alternative to a systematic search of local pharmacies.
Tooth extractions.
Tooth extractions. You've tried clove oil.
Yes, yes.
The drugs on the shelf are those herbal remedies that have been tried for centuries.
We have fries.
The extract of cloves, birch bark, valerian, mandrake, opium and alcohol. Also, with the advent of drug companies, there are a large number of new patent medicines, usually combinations of the old herbal remedies. Fry's vegetable pain cure, Bateman's pectoral drops, Davis's painkiller, and so on.
The very thing. Arsenic. Have you tried arsenic?
I've not even heard of it for that use. I could try it.
Very well, sir.
Arsenic will kill the root of a tooth, and for this reason, the pharmacist considers it a painkiller. But he understands neither how it works nor how much to use. Morton's approach is a random one. Yet a major advance is soon to come from an equally random situation.
And so we see how this mysterious fluid electricity collected by Benjamin Franklin of our own country.
This popular science lecture is being given in Hartford on December 10th, 1844. Attended by Horace Wells, given by Professor Colton, a professorship he's conferred on himself.
Cause my muscles to jerk, my hair to stand on end. There's no question but what it must be a vital principle, and yet this is what descends from the heavens in the form of lightning, as here you see.
The 1840s are a period of great invention, and there's wide popular interest in science, in particular in two different recent discoveries, those of electricity and the gases of the atmosphere.
Surrounding us is a veritable ocean of air, which we inspire and exhale, inspire and breathe out. And in this air there are many gases. Mr. Priestley of England found one of these gases, oxygen. I have studied his work. Mr. Davy, Humphrey Davy, combined oxygen, that which is your active principle, too, that which allows you to flame as much as a candle, and Mr. Humphrey Davy combined that gas with another gas from the atmosphere, nitrogen, which supports no combustion, will only suffocate a candle as much as it does you, and yet the combination of these two, this putting together, this marriage of oxygen and nitrogen, in our own atmosphere yields nitrous oxide. Nitrous oxide, colorless, odorless. Rather than my description, is there a volunteer? If you see the effects, you will have a greater belief. Now, sir, let me start with you. Sir, you will notice there's no odor to this. Now breathe. And breathe it deeply, regularly. How do you feel, sir? How do you feel, sir?
Formidable. Formidable.
Intoxicated?
No.
You feel
Just fine.
very good. Again. Breathe deeply. Regularly. And how do you feel, sir?
Nitrous oxide is, of course, laughing gas.
Breathe slowly and deeply.
One of the hazards of laughing gas is that it can have a quite different effect on different people.
And how are you feeling, sir? How do you feel, sir?
What are you laughing at? What are you laughing at? What are you laughing at?
Was there something strange that happened? What?
Felt frightened?
Frightened? Do you feel frightened now?
No.
You know this man?
It's Dr. Wells.
Very well. Why don't you go sit down? You see, you cannot always predict what happens with this gas. All you know is that there will be...
Cooley, what happened to your leg?
I'm good humored, and yet you saw here...
God.
Didn't you feel that?
No, I didn't feel
Wells observes that he felt no pain with his wounded leg. He asked Professor Colton to come to his house the next day.
Now breathe normally. Deeply, yes, but normally. Back and forth into the bag. And let us see what happens. He will go through a period of excitement.
It's not getting too much, is it?
No, I think not.
He's moving.
I think not. That I've seen this excitement before.
Should I try him now?
Sir, try. Mr. Riggs, please.
He didn't feel it at all.
For heaven's sake, good. Take the tooth. Take the tooth. Please, please.
Got it out.
Remarkable. But he's still not awake. Wake up,
Didn't
Mr.
feel
Wells. Mr. Wells. Wake up. Wake up.
Is it out? It's out. The tooth is out.
Excellent. Excellent.
And so the first general anesthetic, nitrous oxide, is discovered. It's discovered almost by accident by a man who knows little chemistry and has only himself to experiment on. But to spread his discovery, Wells has to cross another bridge. He has to persuade the medical establishment that it will work.
I'm William Morton. Perhaps you remember me from your classes last year.
Yes, indeed.
I'd like you to meet a colleague of mine, Horace Wells from Connecticut.
How do you do, sir?
Good morning.
On Wells' side is the fact that Morton has studied as a student of Warren, and so can get him an introduction.
Well, recently in my practice as a dentist in Hartford, Connecticut, I have started using a gaseous agent known popularly as laughing gas, but
there's a lot against him. Warren knows about nitrous oxide. 20 years before, a whole branch of medicine, pneumatic medicine, has been built up around breathing the new gases, oxygen, nitrogen, and nitrous oxide. Now this is denounced as quackery. In addition to this, wild claims about anesthesia are not uncommon.
You realize, of course, that many have come with comparable claims.
Well, perhaps if we demonstrated it, perhaps that would
And
help.
so, with a certain amount of diffidence, Warren agrees that Wells should demonstrate nitrous oxide to his class later that day.
Gentlemen, your professor has been very kind to me in letting me come before you today. I happen to be a practitioner of dentistry in the Hartford area.
To these upper-class medical students,
And
Wells,
you know, in our
as a
profession,
dentist,
as
is
in
a mere
yours,
tradesman. To compare their profession with his is hardly the best way to reduce their skepticism.
Recently come to my attention that a substance that you may be familiar with by the name of laughing gas, it's also known as nitrous oxide.
In New England, the stern standards of Puritanism are on the decline. Many of the students have attended secret laughing gas parties. For Wells to suggest that there might be a serious use for the gas only increases their disdain.
Nitrous oxide. And not only did I suffer no ill effects, but also I found the whole thing entirely painless. So what I hope we would do today is if we could have a volunteer from one of the students, perhaps we could demonstrate the use of nitrous oxide. Could we have a volunteer? Why don't you come right here? Please have a seat. Can you tell me which tooth it is that's bothering you?
It's the one right behind my canine.
This one here? Okay, fine. Now, just try and sit straight in the chair. Okay. And what I want you to do is to breathe in and out through this spigot, just through your mouth. And you will notice after a few seconds that you are perhaps getting lightheaded, and then you'll be rendered insensitive to pain. Okay. Now, in a few minutes, you ought to start feeling lightheaded. And I just want you to continue breathing nice and deeply. Okay. Nice and deeply. Nice and deeply, please. Okay. Oh.
Wells has no idea that the anesthetic effect of nitrous oxide will vary from person to person. The demonstration fails. Wells is humiliated, and surgery continues without the benefit of anesthesia. But Morton continues to look for an anesthetic. He experiments with ether, a chemical discovered 300 years ago. At first, he meets with minimal success. Then he learns from Professor Jackson, a professor of chemistry at Harvard, that there is a difference between the ether he's been buying from pharmacies and a more highly purified ether. He suspects the more purified ether may work, so he begins to experiment in secret.
Good boy. Good boy. No. No, don't. Good dog. That's a dog. Good.
Morton has tried ether on other dogs, but with varying success. This is the first time he has tried the purified ether.
Telly. You're alive, Telly. Good.
The dog is Morton's own family dog. Like Wells with nitrous oxide, he has little idea what the correct dosage for ether should be. Morton is an ambitious man who has recently begun to make money from his practice. He sees great commercial possibilities should ether work as an anesthetic. And so in the fall of 1846, in these woods outside Boston, Morton makes the discovery that will become the turning point in the history of anesthesia. But Morton still has to persuade the medical profession that ether will work as an anesthetic. Like nitrous oxide, ether is also commonly used as laughing gas, which means that doctors will be skeptical. So Morton takes ether and adds red dye. He calls it lithion. Because he's training as a doctor, he's able to persuade other doctors to accept lithion on trust. Finally, on October 16, 1846, at the Massachusetts General Hospital, Morton administers lithion as a general anesthetic. The patient is Gilbert Abbott, who has a tumor removed from his neck. It is the most important occasion in the history of anesthesia, recorded in this faded photograph. The surgeon is the revered Warren, and so it is Warren who sets the stamp on the first chapter in the history of anesthesia. Through the New England Journal of Surgery, he transmits the discovery to the medical world. It is hailed as successful and widely used in surgery in the great medical centers of London, Paris, and Berlin. But it is to Edinburgh, in Scotland, that the story now moves.
No. Oh.
Lady Delgenny, a Scottish aristocrat, is in labor with her second child. The first died after a labor of 3 days. Her husband has been told that if this happens again, they will have to sleep separately if they are not to endanger her life. Unlike most people, Lord and Lady Delgenny can afford a doctor. Indeed, living in Edinburgh, they can obtain the services of the best. James Young Simpson, one of the leading obstetricians of the time.
Good evening,
Good evening, good evening. It's a guy called Night outside.
Aye.
And how is her ladyship?
Simpson is in many ways a pioneer. He has already started using forceps in childbirth, previously thought an indelicate practice for a male doctor. Also, he's the first person to use ether in labor. This immediately lands him in a controversy. Almost everyone stands against him for one reason or another. The church, the medical profession, even a husband whose wife's life may be in danger.
The church says it's unnatural.
The church says it's unnatural. It's no more unnatural to relieve the anguish of childbirth than to go 30 miles an hour in a railway train, surely?
Well,
but Simpson is quite capable of dealing with the controversy in his own terms.
God's will.
God's will or not, you well remember what happened last time. 3 days in labor and a dead child. I'll not be responsible for that.
All right, my dear.
For a woman with a small pelvis, childbirth can be so exhausting that she's barely able to survive.
Right now, lassie. How are you feeling? How often are they coming now?
Well,
It's been a little bit hard, I know.
But with the pain relieved by ether, there's at least a chance that Lady Delgenny will have the strength to face the last stages of labor.
Just lift up your gown a minute while I examine your abdomen. That's the way. That's very good. Uh-huh. Aye. Uh-huh. Yes. Yes. Uh-huh. All right, now. I'm going to take a little listen to the bairn. Yes. That's good. The baby sounds fine. You're having another very, very bad pain now, aren't you? I'm going to let you breathe some of this ether now. You may not have tried this before, but it smells a bit funny, and it might just possibly make you cough and splutter a bit. It might make you a wee bit nauseous, too. Now, I want you to just breathe away. Just quite normal. That's all right. That's all right. The ether does that. It's irritating. Just breathe away. You'll soon feel better. All right, now. Easy does it, lassie. Easy does it. Okay. Take a deep breath now. Deep breath. That's it. Now. That's fine. One more deep breath. That's the way. All right. Good.
Simpson is using ether not as an anesthetic, but as an analgesic, not for stopping pain, but for reducing it. In doing so, he's acting in a scientific manner. He's taking an invention, and instead of being satisfied with it, immediately looks for a new application.
oh.
I'll give you a bit more of the ether, and we'll get you comfortable in no time.
But ether has its problems, particularly when used in childbirth. It can cause nausea so severe that a person can suffocate.
You want the basin?
Like Morton and Wells, Simpson has no laboratory. But unlike them, who made their discoveries by chance, he understands the principle by which a gaseous anesthetic works. It is breathed in through the lungs, enters the bloodstream, and then reaches the centers of consciousness in the brain.
Benzene. A clear liquid, aromatic smell, not irritating.
Nearly every evening, he experiments with chemicals that can be sniffed in this way.
Now, this next one's a powdered opium. As one of my students suggested that. We normally give it by mouth, but this seems to be a new idea. It's worth a try. Aye, that's certainly an irritating sort of thing. Ah, it's not doing very much for me. I think we're wasting our time maybe on that. That takes too long to act normally anyway.
But in spite of understanding the principle of anesthesia, Simpson's approach to the chemicals is still somewhat random.
Let's take the next one now. Here we are. Chloride of hydrocarbon. Let's try a little of this. It's an oily sort of liquid, all right. No wonder they call it the Dutch oil.
Like most scientists of the period, Simpson has only himself to experiment with. Dutch oil is poisonous enough to kill someone, and Simpson is lucky to be in bed for only a month. But even there, he carries on research with his wife. As soon as he recovers, he begins to experiment again. After a day's work, Simpson often invites one or another of his poor assistants to dinner. Before dinner, they try sniffing a few more chemicals.
What delicacies do we have for tonight? I wouldn't try this one, by the way.
Well, why don't we try this acetone, then?
Let's try that. We'll start with that.
Some for you. Some for me.
Good.
Well,
let's see what this will do.
Here's health, dear.
And to you, Keith. It's not bad. It's a fine ethereal smell. It's not very strong, really. It doesn't seem to do anything to me, does it to you?
I like it, but nothing much else, Doctor.
Mm-hmm. No. I don't think it's going to do very much. Oh, well, what next, then?
How about the benzene?
No, not the benzene. I tried that the other night. It wasn't any good at all.
I think we've tried them all. Oh, there's this chloroform that Dr. Waldy suggested.
Oh, yes, I put that on one side. I didn't think that was going to do anything, but we'll have a try if you really want.
Try.
Uh-huh.
Let's put it in the saucer.
Well, it has a good smell.
Mm-hmm.
As a matter of fact, this stuff isn't bad at all.
It's coming on. I think this is, we've got.
Oh, James, whatever's happened?
How's that?
Keith?
How's that?
Damn it, come. Oh. Oh, my, that certainly did something.
You sure of that?
Oh. I think we've found it.
I think we have.
I think we've really found it.
What did you try?
Draw out your chair, dear. Come along, let's try this again. We were just trying this one here. This is the chloroform.
The date is November the 4th, 1847.
Are you sure it's safe, James?
Of course it is. Of course it is, Jessie. We're
Only a year after Morton's ether, another major anesthetic is being discovered.
Cautiously this time. Now. All right. You see, that's perfectly good. You like it?
It's not bad, is it? Come away, Keith.
Like the other anesthetics, chloroform will also act as laughing gas. Simpson and his family are quick to exploit this as a means of celebrating the discovery.
That stuff, all right. Aye, that's the one.
Not too much.
Chloroform.
No, not too much.
That's the one it is.
The stuff. Oh,
Yes.
that man Wally is a genius.
Yes.
Let's have a little more now. I feel better.
After all this time, I've got it.
Oh, there, I told you it wouldn't affect you too much.
Oh, it's fine.
Here we
You're
go.
quite funny.
Funny's the word. Well, there you are. Have another go.
Yes, this is the one.
Within a few weeks, chloroform is being widely used. It is denser than ether and so easier to carry. Here in the bag of Mr. Megison, an untrained country doctor near Newcastle in England.
Hello, Annie.
Hello.
What is it this time?
It's me too. Ow!
Easy now.
Megison's patient, indeed one of his most frequent patients, is Hannah Greener. She lives alone with her father, farming 2 acres of rough ground.
I'll have to operate.
A week before, she stubbed her toe while clearing stones from their field. It has become infected, and the toenail needs removing.
I want chloroform then.
All right. This is a chloroform, Annie. Take some deep breaths now, Annie. This will take all the pain away. Take some deep breaths. This is the
Chloroform, like ether, is most easily administered by dripping it onto a handkerchief. But in this way, it's impossible to control the quantity breathed in. Mr. Megison, along with most of his contemporaries, has no idea that the effect of a drug can vary enormously with its dosage.
2 more deep breaths.
For Mr. Megison, whose meager earnings depend on the number of cases he can see in a day, chloroform has a particular advantage. It works much faster than ether.
Take some brandy. Take some brandy. Swallow it. Swallow. Oh. Annie?
The coroner's verdict is simple. Hannah Greener has died of the effect of the chloroform. But Simpson immediately takes issue through the medical journals. Simpson claims the girl has choked and the brandy has drowned her. He may well be right. We shall never know. The girl's death casts a shadow over the development of anesthetics, and this is not the only shadow. On Friday, January 21st, 1848, Horace Wills, the pioneer of nitrous oxide, is jailed for throwing acid at a prostitute in New York. He has continued to experiment with anesthetics and has become addicted to chloroform. Wells writes to his wife, "My brain is burning, and I am fast becoming a deranged man. I cannot live and keep my reason. My dear wife and child, if I were to live, I should become a maniac." On Sunday, January 23rd, 1848, Horace Wells takes his own life in jail in New York, the victim of ignorance about addiction. Ironically, as the century moves on, nitrous oxide becomes the most widely used anesthetic of all. It is now 1884. It is a period of hectic activity in America. The wards of hospitals are filled to bursting point. Thousands of immigrants pour into the cities. Immigrants like anarchist Angelo De Luca, shot in the wrist by a policeman. Or his fellow countryman Luigi Longinetti, admitted with a rupture 4 days after his arrival on the pier in New York. Here in Bellevue, the only spare beds are in the basement, And it is in these airless wards that anesthesia has to suffer its greatest setback yet.
The patient, Dr. Jackson, is a young immigrant woman who's complained of severe pain in her abdomen. We had trouble finding somebody who would talk to her, but we thought, nonetheless, that this was possibly a situation where surgery might be of help.
Marcia Gorky has been working 72 hours a week to support her parents. Now she's admitted to the hospital with acute appendicitis.
It's a very inflammatory process, wouldn't you? Agree with me?
Before anesthesia, this would have killed her. But now operations can be done on many parts of the body. Then a few days after the operations, the patients die of infection.
Lymphatic abscess, you know.
That's a reasonable suggestion, Doctor. I've seen at least
20 years before, the great European scientists Semmelweis and Pasteur have discovered germs and bacteria. But germs and bacteria are invisible. The older generation of doctors refuses to believe they exist. The result is a conflict with the younger, more scientific generation of doctors. One of these is an assistant surgeon, William Halstead. Halstead has his own wash basin installed in the operating room.
Nature has provided us some excellent anatomical landmarks. Chloroform.
By now, there are a large number of anesthetic inhalers on the market. With these, the dose can be safely regulated.
Thank you. Get the instruments. Now, I should make this incision in the right lateral rectus muscle.
Dr. Jackson, your hands.
Knife.
Your hands, sir. They're still unwashed. Good day.
Would you assist me?
With pleasure.
Instruments, Dr. Elliott. I'm worried about Halstead.
Surgeons like Jackson are highly competent in their own field. But with anesthesia making possible so many new operations, over 30% of those operated on are dying of infection. Halstead and his close friend Hall are almost the only doctors in Bellevue ready to fight the issue.
Within the fortnight, suppuration will be evident in that one. Well, if you're going by the smell, I think that's the breast patient over here.
Helen McPherson has had a small tumor removed. Without the operation, it may well have healed itself. But general anesthesia has made the surgeons keen to operate wherever possible.
She feels warmer today than she did yesterday. She was 102 yesterday. Her dressing shows a little pus on the lower.
Without surgery, her chances of survival would be much greater.
I doubt it.
My patient is where?
Down here.
Will you wash your hands, please?
Halstead is well-to-do and arrogant. He has overridden the hospital authorities and had basins filled with antiseptic carbolic acid put in the wards. Halstead has also taken the radical step of having a tent erected in the garden of the hospital.
And how many days is he post-amputation?
He's a week now.
Joe Williams has had his leg amputated in the clean atmosphere of the tent. However, the hospital is refusing to collect statistics on the success of Halstead's new antiseptic methods.
I changed the dressing yesterday. I noticed you made his stump shorter than most you've been making recently.
Yes, I have.
It's all right.
I think I found
Halstead is rich enough to have traveled to Vienna, where he's learned about the germ theory.
less tissue. It's encompassed with these sutures.
It's also his continental connections that enable him to make a major development in anesthesia.
You've all been familiar, I'm sure, with Kohler's experiment, which was reported in Vienna on the eye of the dog. And note that...
Stay, puppy. Stay.
The animal reacts quite briskly to this stimulation of this feather. However, with the administration of some 4% cocaine hypochlorite instilled within the eye...
Recently, coca has been brought back to Europe from South America, where it has long been used as a narcotic.
Which renders the cornea completely insensitive to things such as a feather, after, of course, a few moments have elapsed. See, the animal hardly objects to the pressure of the feather upon the cornea at the present time. Whereas on the other side, a brisk blink is elicited.
Good girl.
Dr. Hall and I have actually, on our own, extended a little of Kohler's principle and have been applying some of this cocaine on our tongues. We've been quite interested in the effect.
Even as a young doctor, Holstead has a reputation of being strict and demanding with his students. Yet they compete to come to his expensive tutorials.
Why don't you stick your tongue out for me? Try and hold it there. May I have your pen? Here's what a show. And let's see how large an area is actually. Feel that?
No.
About there.
The student feels pain least at the central point where the cocaine has been dropped.
Stick your tongue out again. About there.
No.
There?
Slightly again.
What about there?
Yeah.
There appears to be some decremental...
Cocaine will work as a local anesthetic on the tongue or eye because they are not covered by an outer layer of skin.
What nerve would you say we should select?
So far, this is a repetition of experiments done by Kohler and Freud. Now Holstead suggests taking it a step further. He suggests blocking a nerve with anesthesia. If the nerve is blocked, this should prevent pain in the part of the body served by the nerve.
Here, as you suggest.
But to block a nerve, he must get below the skin.
And block it, say, at the mid-portion of the arm, here.
Dr. Hall has recently acquired a Pavez syringe, the forerunner to the modern hypodermic needle. It is the combination of this technological development of medicine with cocaine that makes the first experiments on nerve block or regional anesthesia possible.
How much is it recommended?
1.5 minims.
Would you undo your cufflink, please? We'll select the site as we indicated on the atlas of the mid-portion of the forearm, as we demonstrated. Precisely, you felt that?
Yeah. There's quite a sharp pain.
Then we must be in the nerve. Where was the pain?
Well, right at the point of the injection. And then it followed very quickly.
Down into the hand?
Yeah, into the palm of my hand, the left portion.
Right, we'll put 1.5 minims here.
To do this correctly requires injecting to within a millimeter. It's Holstead's German training that makes him a good enough anatomist to do this.
Well, there's more numbing that ranges from about here to about my wrist.
If the ulnar nerve has been blocked, sensation should be lost in the little finger and that part of the third finger served by the nerve.
Do you feel that?
No, there's nothing there.
That?
No, nothing there.
That?
Yeah.
That?
No.
That?
Yes, sir.
That?
Yes. Yes.
And that?
Yes.
And that?
Yes.
But not there.
No.
Nor there.
No.
Nor there. So it would appear that the hypothesis is correct. And that by precisely placing 1.5 minims of cocaine here upon the nerve, we have abolished sensation here in the hand.
It is in this room in the cold winter of 1884 that Holstead pioneers regional or nerve block anesthesia. It is a major step forward in anesthesia and has advantages both in small operations and in making recovery much less unpleasant. It puts Holstead in constant demand. It's 5 o'clock in the morning. Holstead is returning from an emergency case. He seems to have a limitless quantity of energy and works at 4 New York hospitals. Now Holstead is about to settle down to a long academic paper on regional anesthesia for the New York Medical Journal. Cocaine, the forerunner of Novocaine, is also used as a stimulant in patent medicines. Holstead and his medical colleagues, by injecting it, get an even stronger effect, enabling them to go for days on end without sleep.
Good morning.
Good morning.
Is that the draft of your paper now?
Yes, I think the editor wants it sometime later this week. I worked on it some last night after we finished that strangulated hernia.
Neither indifferent as to which of how many possibilities may best explain, nor yet a... This makes no sense at all to me.
To you, it makes no sense? You do read the King's English, do you not? Read it again.
When surgeons have, and that so many quite without discontent could have exhibited scarcely any interest in what as a local anesthetic had been supposed, if not declared by most, so very sure to prove, especially to them, attractive, still I do not think that all this circumstance wants or some sense of obligation to rescue fragmentary reputation for surgeons rather than the belief or opportunity instead for assisting others to an appreciable extent inclines me several years ago to which on the subject in hand the greater part of a somewhat comprehensive paper which poor health has disinclined me to complete.
Nothing is known about addiction. Halstead has to give up practice and goes alone to a sanatorium on the New England coast. Cocaine claims many victims among the doctors who pioneer with it. Some of them, like Halstead's colleague Hall, die young. Halstead at least survives and becomes the first professor of surgery at the new Johns Hopkins University. It is now 1902. William Kelly is a teller in the Baltimore Bank. But for 6 months, he's been unable to work. He's hyperthyroid, and this has made him too nervous to handle large sums of money.
Good morning, Mr. Kelly. Are you feeling a bit sleepy?
This is the new operating room at Johns Hopkins, designed especially by Halstead.
Kelly, I'm going to wash your neck with some soap and water. The doctor will be here soon. Good morning, Dr. Halstead.
Good morning.
I trust you're well this morning.
Yes. Good morning.
Good morning, Doctor.
How are you, sir?
Fine.
Very good. Shall we commence, then? Anesthetic? Good morning, Doctor.
Morning, Dr. Halstead.
Now, my good man, I'm going to be injecting your neck here. You'll feel the bite of the needle, like that. Then you'll feel the anesthetic.
A danger in thyroid operations is that the vocal system will be damaged.
Do you have my stitch for the drape?
As might be expected with a man who still sends his shirts to Paris to be laundered, Halstead is as precise and formal as ever.
Very well. The knife, please. Now, sir, you let me know if you feel the least discomfort, shall you?
Yes.
Make my incision. This 1 finger breadth above the collar. Artery forceps, please. Now that I've split the sterno, which muscle? The sternohyoid.
Before anesthesia, surgeons were limited by the speed in which they had to operate. But Halstead now develops a technique which involves operating slowly and meticulously.
Sternothyroid, which I shall similarly reflect. Sir. You have my retractor?
Yes, sir.
Okay. Which I shall reflect there. Are you feeling any discomfort?
No.
Plunge, please.
Halstead is the first American surgeon to take full advantage of the time that anesthesia buys. By taking care not to damage the tissues, his new clinic achieves an incredibly high rate of success. He gains the reputation as the father of American surgery, and also as a great teacher in his own stern fashion.
It is only with the recent advances of Coker and his clinic that we've been able to operate with some success upon the thyroid. Dissecting scissors, please. Not that instrument, please. Dissecting scissors.
I'm sorry, Dr. Halstead.
But in spite of his professional success, Halstead remains aloof and isolated. He retains the exotic tastes of his younger days, but he only overcomes his addiction to cocaine by coming to rely on large doses of morphine. This, however, was the kind of price that men like Halstead had to pay in their personal lives for laying the foundations of modern anesthesia.
Well, I think that she's going to be relieved of her complaints.
Well, that's good.
What kind of anesthesia did you use? I haven't been listening.
Well, I put it off to sleep with phenethol and then nitrous.
In Halstead's time, surgeons were their own anesthesiologists. Now, with greater and greater control possible over the patient's body, the anesthesiologist has emerged to be the surgeon's equal. Instead of being given one large dose, the patient is now continually anesthetized, and the anesthesiologist keeps a constant check on her level of consciousness, her blood pressure, temperature, breathing, and so on. Partly, this is done by electronic monitors, but essentially the skill of an anesthesiologist is to have the sensitivity to feel and predict the condition of the patient in a state never far from death.
Try out, but never had any more effect.
An experienced anesthesiologist can tell a great deal from small details. A glance at the patient's pupil, or the touch of her skin.
Yeah, that's right.
Can you open your eyes yet? Hi.
Anesthesia in this century has seen thousands of new anesthetic drugs developed by chemists.
All went well. I'll take you to recovery room now. All right?
These are improvements, but ironically, for all this research, science has been unable to discover exactly how anesthetics work. Exactly how it is that the pain of surgery is prevented from reaching the centers of consciousness.
Take some nice big breaths, Alice. Big breath.
Essentially,
big breath.
anesthesia is still dependent on the discoveries of Morton, Wells, Simpson, Halstead, and their 19th century colleagues.
You hear me?
The discoveries that a range of chemicals can produce this strange sleep.
Let's your open eyes.
Man's power against pain.
Can you open your eyes, Helen? That's a girl. Hi. You're just waking up. You'll be in the recovery room, and you'll be there for a short while, then we'll take you back to your room. The operation's all finished and all went well. Can you hear that? Good. Good girl. Yes? All went very well.
NOVA is made possible by grants from the Carnegie Corporation of New York, the Corporation for Public Broadcasting, the National Science Foundation, the Polaroid Corporation.